All right, so thank you so much for allowing me the opportunity to speak today. And I apologize that I wasn't able to be there in person this week. So I'm really looking forward to discussing with you a paper that Dr. Curry and I have recently published, where we describe a new cohort of families who have mostly children affected with PPM1D variants causing Jensen-De Vries syndrome. And Dr. Curry and I have been working on this for several years, and it's truly been a collaborative effort connecting with doctors and with families throughout the world, really. So we're really happy to share this with you. All right, I'm going to make my screen a little smaller here. Okay, so this is the title and the author line of our paper. So we describe 34 new families with a diagnosis of Jensen-De Vries syndrome. And those 34 families include 37 people. There's quite a diverse or broad age range from 8 months to 62 years of age. Some of the older folks were parents who were also affected and had affected children. We provide updated medical and developmental information on this group of people that I'll share with you in the slides that follow. Dr. Curry was able to engage with an artificial intelligence program called Face2Gene to create a facial gestalt, or sort of a summary of facial features that is seen in this condition. And then as part of this paper, we also reviewed the current medical literature to see how many cases were out there besides the ones that we were publishing, and see what additional information we could find there. So to start with the genetic diagnoses, so Jensen-De Vries syndrome is caused by disease-causing mutations or variants in the gene PPM1D. They all are the type of variant that causes a shortened or truncated protein product, and they all occur in the last 2 exons 5 and 6 of this gene. And so what this figure is displaying, the little plot on the bottom is showing the whole gene, exons 1, 2, 3, 4, 5, and 6 in different colors. And then expanded up top here are exons 5 and 6, where you can see the different variants that were reported in this cohort. Oh, and I should say also that the majority of these, so all but 4, were new mutations or new variants, meaning they arose newly in the affected person or in the child. But we did have 4 cases with autosomal dominant transmission, where an affected parent passed on the variant to their child. In terms of the perinatal history, so the history surrounding the pregnancy and early neonatal period, overall, there wasn't a striking pattern of prenatal symptoms or signs. So there are a couple of pregnancies where there was polyhydramnios or extra amniotic fluid. There were a couple of parents who had gestational diabetes. Most of the children were born full term. There were a couple that were born early, and a minority had neonatal complications, with some needing some assistance at birth, oxygen or help with breathing, a couple that were evaluated after birth for fast breathing or for pauses in breathing, and one with low blood sugar. Again, probably not enough to suggest a pattern here. Some of the other common features that were noted early after birth and neonatal period are the low tone, and also earlier onset of constipation, in addition to difficulty with feeding. And so I think a lot of these things are non-specific, but certainly would potentially prompt evaluation for a genetic condition if there is a neonate or infant that had these features. In terms of the growth, so as I mentioned, the children that we report on had a wide range of ages. And so what we're reporting here is the Z-score, sort of a scaled score of how their growth is in relation to similar aged children. So overall, and so in generally, we think of a Z-score of at least greater than -1, but more like closer to -2 of being a significant difference. So the weight had a Z-score average weight of between 0 to -1, so potentially a little bit smaller than average, but really looking at kind of the error bars here, it tends to center around average. The height tended to be lower than average, and so did the head circumference. In terms of development, in the people that we described, there is a mean age at walking of just over 2 years of age, and then the numbers reported in parentheses are the interquartile range, so the first to third quartile, to kind of give a sense of the spread of that data. There is a wide spectrum of age at first words, ranging from 12 months to 15 years. The median was 20 months, so about a year and a half. And there was a really broad range of cognitive outcomes. There was really a minority that had direct IQ testing, and part of that, I think, relates to just the age of the people that we report on, where some of them are probably too young to do this type of testing. The median was 70 with a range of 58 to 72 in this small subset. There were 8 people who were reported to have features of autism spectrum, although there were a couple others where parents had mentioned that someone might have suspected some features of autism spectrum disorder. There were 17 that had been diagnosed with ADHD, 18 described to have anxiety, and 21 described as hypersocial, which has some similarity to a different genetic condition called Williams syndrome, where people are known to have these very social personalities. We have a little bit of insight into the adults from the parents that we saw that had affected children, and then some of our individuals that we reported on were approaching adulthood themselves, or were adults. The parents that we describe who had affected children tended to have some work experience. At least one of them completed high school. 2 of the affected mothers ran their households. And then the next thing I was going to speak about was the physical features. I would say before moving to this, I know that Dr. Curry was the one who was interviewing a lot of our families directly and gathering this information. And I know she said many times that the personality is unique to Jensen de Vries syndrome and is just such a delightful, wonderful personality. And so it's something that is hard to capture in a medical report, but we hope that when we described the different shared features in terms of the development, that's something that really stood out. And then looking at the physical features, which is the photographs that were shared by many people, maybe some of you are here today. This is really one of my favorite things because these children are just so adorable and beautiful, and we have such a nice array of kids of all different ages. So I'll show you some of those pictures now. So these are some faces of the children at an earlier age. So as you can see, infancy to kind of toddlerhood. I'm just going to move myself here so that you can see these children. So just really just happy, lovely children, as you can see. Some of the features, because we're geneticists, we like to comment on some shared features that might be a little bit unique to this condition. And so some of the things that we thought that were similar across the different children were a bit of a broad forehead, kind of a broad mouth with a thinner upper lip. This is some of the children as they're approaching school age. And so again, you can see some of the physical features that are shared across the children, but they certainly all have their own very unique, features that they've inherited from their family. And then these are some of our adults. And so there's some of our adult probands that we described are the affected people. And then on this side, panel D are showing some of the familial cases with affected moms and their children. So this is showing the hands and feet. And so many of the people with Jensen de Vries have small hands or feet and have hypoplastic nails. And so you can kind of get a sense of that from looking at these pictures, although I recognize that it's a little bit difficult to kind of zoom in on all of these things. But I hope you can get a sense that the hands are a little bit on the smaller side. And so for some of them, you can see the hypoplastic nails too, where the nails are smaller than typical. And again, I'm just going to move myself here. So taking all of this into account, this is the Face2Gene program that Dr. Curry used to create a facial gestalt. So the unaffected controls is pretty much just control faces that they have of kids that are not known to have a genetic condition. And that's kind of the composite summary of what the the face looks like. And then this cohort one, at the time she had 14 people whose faces she was able to put into this. And so, I think you can see some of the features that we described in the looking at the spread of all the faces, with maybe a bit of a broad forehead and then a broad mouth with a thinner upper lip. And, it looks like the AI also picked up that many children are wearing glasses, because as I'll get into it, some vision issues can also be seen in this condition. All right, so with that in mind, I'll segue to the medical concerns that we describe in our paper. I think the largest kind of organ system that tended to be affected was the gastrointestinal system, where 16 people were described as having GI or reflux disease. An additional six had gagging or choking on liquids. A lot of this was in earlier childhood and tended to get better with age. And 20 had vomiting episodes, and 6 of these were diagnosed with cyclic vomiting syndrome. So this is a pretty high number, I think, for this cohort, and suggests that this is one of the more common features, or one of the hallmark features of this condition. Additionally, constipation, as I mentioned, was reported in a large number of individuals. It's possible this might be more prevalent than reported. And we did note kind of qualitatively that this tended to improve with age. I think the other medical issues seen, many of these things were sporadic enough, I think, to not be clearly associated with this condition, but 2 people had seizures and 1 had an isolated febrile seizure. There were 4 people who had recurrent migraine with vomiting. These tended to be the people that had the cyclic vomiting syndrome, and so as they entered their older years or towards adulthood, it tended to manifest more as migraine than with just vomiting. There were 4 people with documented growth hormone deficiency, although most of the people were not tested in this group. And then visual problems were noted in a majority, and hence the glasses that were seen in some of the pictures. And again, these don't tend to be, these are things that would be picked up on generally a routine eye exam, and many of them would be treated with things like glasses. So that kind of encompasses the highlights of what we reported in our cohort. I'll next briefly describe what we found in the literature and kind of see the frequency of some of the features that we reported, and how that looks in some of the more historic cases. So I found 24 cases in the literature of Janssen-de Vries syndrome. And so what this graph is showing, I'm going to just move myself here again, is so the black bar for each feature, the black bar is the number of people with the feature in our cohort, and then the blue is the number that have that feature in the literature, and then the orange are the ones that we definitively know that they do not have that feature. And then the gray bar are those that we don't know. It's just not reported as a yes or a no. And so the total number is a little bit over 60, including the cases from the literature in our cases. And so you can get a sense of the frequency of these things. And so the facial features, such as broad forehead, thin upper lip, and broad mouth, tended to be seen in the literature. Similarly, small hands and feet were seen commonly. Hypoplastic nails. This is the short stature that we were speaking about before. Intellectual disability was also a very common feature. And so then constipation, cyclic vomiting. So cyclic vomiting was reported in many cases, but interestingly, there were several cases from the literature where it was not present. Other things that have been associated with this condition are a high pain threshold, and then hypotonia or low tone, which is a non-specific feature, but is something that many people reported. Since we published our paper, there is actually a new report that came out about a month, or I think it's about around the same time, but maybe a month after ours. So I don't think either of us were aware of each other. And this looks like it's a report from Finland. So they report 4 new patients with Janssen-de Vries syndrome, and they review the same literature that we reviewed. So it's too bad that our report wasn't out yet when they were doing this. But I think one of the things that they're showing again here are the the similar facial features that we had mentioned, and then the hypoplastic nails is what and the smaller hands is what they're showing with these pictures of the hands of people below. I did read this paper too. I think aside from I didn't see anything new there necessarily that we hadn't included in our report, but I think it does tend to corroborate the things that we had discussed. And so in the discussion of our paper, Dr. Curry really wanted to put in some management pearls, and I agree with her that it's helpful to kind of think towards, not just defining these features, but also thinking about what we can learn from families about how to manage some of the features that we're seeing. So anxiety was something that many families were managing, and these are some of the helpful strategies listed here that Cindy had, or Dr. Curry had heard from speaking with the families. Some families had used things like SSRIs with some variable success there. Some families had reported using cannabinoids with variable response. I think overall, just given that the developmental and behavioral features seems somewhat unique to this condition, it's probably worth doing some future studies to see if there's something more specific that helps for Jensen de Vries syndrome. And then related to the behavior, some families reported some issues with kind of lack of boundaries, outgoing personality, potentially, a similar kind of a lack of fear, difficulty with impulse control. And it seemed like these were just very individual kind of things that had to be tailored to the person. It's hard to give kind of a blanket approach to this, but it is something that several families were working through. In terms of the growth, the short stature that we see in many families, some families have undergone evaluation, as I mentioned, for growth hormone deficiency and been treated with growth hormone. There was kind of variable response in our group. So we didn't feel like there is evidence that all children with this diagnosis should be treated with growth hormone to help treat short stature, but it might be one thing that we do see is, families can be seen by an endocrinologist that can look for growth hormone deficiency and have a more tailored individual discussion about whether growth hormone treatment would be helpful. One of the other significant medical issues that families are managing is the vomiting, or the cyclic vomiting in particular. I've listed some of the triggers that families have reported here, and then some of the potential treatments that people have undertaken as well. And again, kind of variable outcomes depending on the child. There is a support group that might be helpful, which is a really lovely resource. And in writing this report, we worked with some doctors that are working on some further studies specific to cyclic vomiting in Jensen de Vries syndrome. And so we look forward to seeing their work published, which might lend some additional understanding and lead towards some additional management recommendations. So with that, I'll close, and I'll thank you again for your kind attention to this presentation, which I'm happy to share. Again, this is published in our paper, so that's out there too. I'm sorry that I'm not able to take live questions at the moment, given that this is virtual, but I'd be really happy to answer any questions by email, and the organizers can share that. I'm happy to do that, and just want to again thank all the amazing parents here and families, and especially the organizers of this event. It's just such a great opportunity to come together, and I hope that you've learned something from this presentation. I learned a lot in putting this together and working with so many different families and physicians and genetic counselors. So it's really been a pleasure, and I look forward to hearing from you. Thank you so much.